Ladies and gentlemen, thank you for standing by and welcome to the COVID-19 Media Briefing Conference Call. At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question-and-answer session. To ask a question during the session, you will need to press star 1 on your telephone. If you require any further assistance, press star 0. Thank you. I would now like to hand the call over to your speaker today, Mr. Michael Schomer. Please go ahead.
Thank you for joining us for the COVID-19 media call for November 24th. We'll start today with comments from Health Commissioner Jan Malcolm and Assistant Commissioner Dan Huff. We'll then open up for questions from reporters on the line. I should mention that we also have MDH Infectious Disease Director Kris Ehresmann online to help us with any questions. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Globally, an additional 548,000 people were diagnosed with COVID-19 yesterday, bringing the cumulative total to more than 59.7 million cases. Over 9,000 more people died, bringing the worldwide total to over 1.39 million deaths. More than 172,000 more United States cases were confirmed yesterday, so we're now over 12.4 million cases in this country. With just over 900 more deaths yesterday, the U.S. has already seen over 257,000 deaths. Minnesota added another 6,423 cases yesterday on a testing volume of 53,173. This brings our state to a total of 282,916 COVID cases. While it's been 10 days now since we had our highest ever daily case count, we have seen our case numbers fluctuating from day to day. So we would not consider that we have any sort of a reliable trend just yet. While we've certainly been pleased to see somewhat lower case counts in some of the recent days, we think that this might be another of those patterns that we've seen earlier in the epidemic, kind of a series of waves. And possibly we are in a trough now between waves and do not necessarily think that what we are seeing in recent days represents the downside of a peak. There are 1,828 people currently in Minnesota hospitals with COVID-19. Of those, 379 are in intensive care. To put this in context, this is 1,080 more beds occupied by COVID patients than at the beginning of the month. And we've talked on a number of occasions about the fact that our hospitals in Minnesota generally are pretty full. So with this amount of beds now being occupied by COVID, that puts a real additional strain on the system, as we've talked much about. The share of intensive care unit beds around the state being needed for COVID-19 patients has also steadily increased, especially in our tertiary care hospitals. Hospital admissions remain very high, and the 7-day average continues to grow. So even as we've seen some of our case counts a little bit lower in recent days, that is not true of hospital admissions. Sadly, the deaths of 38 more Minnesotans were reported to MDH yesterday. We've now lost 3,303 of our family members, friends, and neighbors to this virus. Half of the deaths reported yesterday were in greater Minnesota, half in the Twin Cities metro area. And 23 of these deaths occurred in residents of long-term care facilities. I'll just remind us that there have been 360 deaths just in the last 7 days. So as with hospitalizations, we are seeing increased numbers of Minnesotans dying as a result of these high case levels that we've been talking about for the last several weeks now. The weekly change in cases, as I mentioned, has moderated a bit. Week over week, we've seen 19.4% more cases this week than last. But that was down from a weekly rate of growth of 24.4% the prior week. We did have extremely rapid case growth at the beginning of this month, and the case growth in more recent days has been somewhat steadier. The weekly change in testing continues to be pretty stable at an increase of 10.8% week over week, approximately the same as the week prior. Testing levels have been relatively steady in a very healthy range of over 50,000 cases, 50,000 tests per day, and that's been true this entire month for the Maine. The 7-day average testing positivity rate is a bit of a bright spot. That 7-day average test positivity rate is 14.3% now, down from 15.2% the week prior. It was back on October 6th when we started to see the test positivity rate climb day after day after day, and this is the first time since then in the last few days that we've seen that rate stable or even declining a bit. So we do consider that a bright spot in the data. With that, I'll hand this over to Assistant Commissioner Dan Huff to talk about walking through our recent testing recommendations update. Dan?
Thank you, Commissioner. On Friday, we sent out a news release offering updated recommendations on testing, and we wanted to take a moment to reiterate that information and offer some additional thoughts. As you've heard, we are dedicated to providing low barrier access to COVID-19 testing for all who need it. Right now, we're seeing strong demand for testing, and we want to make sure that if and when you need a test, you know how to make it happen as quickly and as smoothly as possible. We are asking people to make a plan now by reviewing the recommendations on who needs to be tested, when to be tested, and which option may be best. The value of testing is to be able to identify as quickly as possible individuals who are COVID positive so that they can isolate to protect others from the virus. We encourage people to evaluate whether it is necessary to receive a test using the criteria that I will now go through to ensure we can maintain the fastest turnaround time. So who should get tested? Anyone with symptoms should get tested right away. So symptoms of COVID-19 can include a cough, shortness of breath, fevers, chills, headache, muscle pain, sore throat, or loss of taste or smell. For those who have mild symptoms, the COVID-19 Test at Home program may be your best option for getting tested in the comfort of your own home. However, if you need to leave your home to get a test, you can do so and reduce the risk for others by wearing a mask and staying 6 feet away from all other people. If you have moderate to severe symptoms, do not visit a COVID-19 community testing site. Call your doctor or other healthcare provider or go to the hospital. Anyone who has been exposed to someone who tested positive for COVID-19 should also get tested. It's best to get tested at least 5 days after the last time you were close to the person with COVID-19. If you get tested too soon, the test may not be able to pick up the virus. You will need to stay home for 14 days after your last contact with a person who has COVID-19, regardless of whether you have symptoms. Even with a negative result and no symptoms, you still must quarantine for 14 days. Again, the COVID-19 Test at Home program may be your best option for getting tested, especially if you learn about exposure early in the 14-day window. If you would prefer to visit a community testing site, make an appointment. If the site nearest to you has no available appointments on the day you're looking to get tested, either look at a later date or try finding a testing site a little farther away. Anyone who is still working at places that remain open, so this includes maintaining our critical infrastructure, first responders, are healthcare workers, child care workers, and those working in retail. If you're in this category, keep in mind that even if you do not have symptoms and have not been notified of exposure, you are still at some risk given how quickly the virus is spreading. Workers at these places should make a plan to get tested at least once before December 18th. If possible, get tested once near the beginning of our 4-week dial-back period and once again towards the end of this 4-week dial-back lay-low period. We urge you again to make an appointment at the community testing site. And again, the COVID testing at home program may be best for you. Now, while testing sites remain open for walk-ins, it is a good idea to make an appointment and only use the walk-in function if you need a test that day. This scheduling step is for your benefit as well as the testing site. Having a lot of people coming without an appointment can create lines and increase potential for unsafe in-person gatherings. Testing sites in greater Minnesota and outer suburbs generally have more appointment availability than those sites in the core metro area. You can look at testing sites near you to find one with available appointments. Make sure you know what to do while you wait for your test to arrive in the mail and after you've been tested. Visited I Got Tested Now What on our state's COVID website. We are pleased to report that the COVID-19 Test at Home program has been wildly successful. We have sent out over 210,000 tests to Minnesotans as a part of that program. 38,000 tests have been returned and run through the labs with results sent back to those folks. These tests do no good sitting in their package. There's no need to hoard these tests. Please use the test and send it back in to get your results. A few reminders. Vault Health sells tests to its website. Minnesota residents should log in through the State of Minnesota website, mn.state/COVID-19, to make sure that you take advantage of the Minnesota-based testing program. And again, the shipping of the test our shipping partners do not run on Sundays or holidays, so plan accordingly. One question we get fairly often is whether everyone aged 18 to 35 should get tested. We know the data show that people aged 18 to 35 pose a significant risk as asymptomatic transmitters of the virus. We do want people in this age group to seek out testing, particularly if they are working at the industries that remain open during this dial-back period, or if they're frequently visiting those sites. This is another group for whom the test at home option may be best. Given the governor's dial-back order, we urge people to avoid social gatherings and therefore decrease their need to seek out testing. We encourage people to evaluate whether it is necessary to receive a test using the criteria we've shared with you today. We want to make sure that we maintain the fastest turnaround time for all Minnesotans who need testing. And as a reminder, once you get tested, especially if you have symptoms, but also if you have been exposed to someone with COVID, it is important to stay home and away from other people while waiting for your test result. If you know you've been exposed and had a close contact with someone who is confirmed to have COVID-19, it's important that you quarantine for the full 14 days after that last known contact, even if you test negative and even if you don't have symptoms. Thank you. Mike, I'll turn it back over to you.
Thank you, Dan. Operator, we are ready to take questions.
Okay, so as a reminder, to ask a question, you will need to press star 1 on your cell phone. To withdraw your question, press the pound key. Again, that is star 1 on your telephone. Please stand by while we compile the Q&A roster. We do have a question from Kate Radatz from WCCO TV. You are now live.
Thank you. Hearing those test guidelines and kind of reiterating those for people, are there enough tests for everyone, and how long is it taking to get tests back? Is it starting to take longer for people?
Dan, could you take that, please?
Sure, Commissioner. So right now our test turnaround time for saliva testing at Adult Health is running between 24 and 48 hours. So 1 to 2 days, a very good turnaround time. Turnaround time for our nasal swab sites are also they're running closer to 2 to 3 day turnaround time. But really it's about managing the supply of testing for everyone in Minnesota who needs it. Any source, it's like toilet paper. If everybody went to the store right now and bought up all the toilet paper, it'd be gone. But if people who are going to get testing need to get testing, we have enough tests. And our turnaround time has been fine. The reason that we're providing these guidelines is so people know how to best use the testing resources we have in Minnesota. We have worked really hard to make sure that every Minnesotan has the testing resources available to them in a low barrier fashion. But that doesn't mean that we all rush out at once and get a test. So that's really the reason for providing these guidelines today.
Got it. Thank you. And just to follow up, I know this has been touched on before, but now that we're 2 days out, from a big holiday, hearing of families that are planning on gathering, but they say they're all going to get tested, and so it's safe. They're saying it's safe. Can you talk about, I know you've touched on this, but how can you guarantee if family members are all going to get tested and then they all get together, is that foolproof?
No, it is not foolproof. Oh, I'm sorry, yeah. Commissioner, go ahead.
No, that's fine, Dan. I was going to ask you to comment and then ask Kris also to weigh in on this one.
Sure. So it's not foolproof because a test tests what you are, how much virus load you have in your body at any given time. You can be infected and even infectious, but the load in your body is not high enough to be detected by the test at that time. Testing is really important to identify if you're infected so that you yourself can isolate, but it is not a get-out-of-jail-free card, and it does not get us out of having to take smart precautions, which is, especially during this dial-back period, staying only within our household pod. Go ahead, Kris.
Yeah, I was just going to say that if we thought that might have been an effective means to allow people to be together, we would have suggested it. But at this point, that won't solve people's problems. If you had been tested 2 weeks ago and tested negative and then committed to quarantining for 14 days and your family did that, that might be a different story. But a test is only as good as the day of the test. So if you're negative and you were tested on Sunday, you could easily be positive Monday, Tuesday, Wednesday, or Thursday. So that isn't a means to safely gather. So we want to discourage that. If people are going to ignore the executive order, which we don't advise, I think it's best to take precautions and assume that everyone that you're gathering with is potentially infectious. Wear a mask and socially distance.
Thank you.
Next one on the queue is Courtney Godfrey from Fox 9. You are now live. Courtney, you are now live.
Operator, why don't we move on to the next question? Maybe we can come back to Courtney later. Operator, if we could move on to the next question. Thanks.
Okay, for the next one, we do have Catherine Richard from Minnesota Public Radio. You are now live.
Hi, yeah, I have two capacity questions. The first has to do with long-term care workers, especially in facilities in greater Minnesota. I received an email this morning that originated with MMB that basically says that they're going to be asking every state employee if they would be willing to volunteer to go to these facilities, and that they'd even accept folks who don't have prior experience, although train them to do certified nursing assistant type work if they did agree to be redeployed. Can you just speak to what that says about the situation, and whether you have any, goals, I guess, in terms of the number of people you'd like to recruit through this request?
Sure. This is Commissioner Malcolm. I think I can address that one. I think this is just an example of trying to think farther out ahead and see. We're trying to really turn over every stone, so to speak, to think about ways to support the staffing needs across the healthcare continuum, but particularly in long-term care, with the number of healthcare workers in these settings that continue to be exposed. We know, and we've talked about this before, staffing has always been an issue in long-term care, and this pandemic has certainly exacerbated it significantly. Right now, we are, through the State Emergency Operations Center, we're working with 47 long-term care facilities as we speak who are in some form of a crisis staffing situation, and supporting them with hooking up volunteers through the volunteer management system that we talked about before. The National Guard has been sensational in terms of making additional Guard resources available for crisis staffing situations. We've brought in federal public health nurses to support this, but we know that for instance, the federal resources are going to get tougher and tougher to come by as the whole nation is going through this surge. So this was a step just to frankly, at this point in time, to gauge interest on the part of state employees who may have the capacity to volunteer. And there are, as we know, many, many different types of roles that folks can play to do duties so that the direct care staff can focus more on patient care. So this would be just another way of trying to identify potential additional resources that could be brought to bear if needed. But I want to be clear that we're at this point in time, we have been not without a lot of work, but able to support the crisis staffing needs that we've seen, but we just keep wanting to think a couple steps further ahead to see where would we go next if needed.
Okay, and just a quick capacity follow-up question for Commissioner Huff. We continue to hear that people who have ordered the in-home saliva tests are waiting several days to get theirs, and also folks who are trying to order them online and are being told that they can't, like this, they're out of them for the day. Can you speak to both of those issues? I mean, what's being done to maybe expand the number of tests that can be ordered?
Sure. So we've had overwhelming participation from Minnesotans, which is a great problem to have. It did create some logistical hiccups for us. And so working with our shipping partners, primarily UPS and U.S. Postal Service, we've had to, add more drivers, add more routes for them to pick up all these tests. That's set us back a couple of days, but we've caught up on that. We are limiting or capping the daily amount of these tests to be sent out at 12,500. And that is really to maintain turnaround time, because we know how important it is that once you order a test, you want it to be delivered the next day. And so that is really to help manage that supply demand relationship and to make sure that we can have good, quick turnaround time. So we do ask that if you find the message that they're all booked out for the day, then to come back tomorrow or to visit a community testing site. But there again, we do ask that unless you meet one of those top criteria, the dial-back period is a great time for all of us to lay low. If we are not having any social interaction outside of our household pod, then we're not going to get exposed to the virus, and therefore we don't really need to seek out testing. That's why this dial-back period is so important, that all of us take it seriously, and it may be tempting to cheat, but it's just not safe to do so.
Okay, thank you.
Next one on the queue is Jessica Miles from KSTP. You are now live.
Hi, thank you. This question is for Kris. Kris, with all of the talk about the COVID vaccine, should people be concerned with a fast-tracked vaccine? And with a virus as rampant as COVID is, as we are hearing from you guys, is there concern with those not wanting to get vaccinated once that does become available?
Sure, that's a great question. We certainly have. I certainly have commented that I wish that the name chosen for the project was not warp speed, but rather safe speed. But I can tell you that these vaccines will be safe, and what I'll explain is that the things that have been done to help speed up the process are not things that affect the safety of the vaccine. So, first of all, there's been a lot of research done in the last couple of decades, and so manufacturers were able to sort of grab from that and start a bit ahead of the game. Another consideration that they've done is typically with a vaccine trial, the clinical trials are done in a sequential manner. So you do phase 1 and then phase 2 and then phase 3. In this case, in order to reduce the time needed, they started, for instance, recruiting for the second and third phases of the trial while they were still in the first phase. So that was another way that they were able to be more efficient in their work. The other thing is that the regulators have been working with the manufacturers all the way along, looking at the data, checking in with them, making sure that, the manufacturers know just what they need to prove the effectiveness of the vaccine, and the regulators are able to be looking at the data as things go on so that they're in a better place to more quickly judge the effectiveness and safety of the vaccine. So those things have been done to help reduce the time needed to bring a vaccine to market. Another thing that's been done is that typically a manufacturer will not begin to produce vaccine until they're sure that they will have FDA approval, because that is a financial cost to them. And if they wouldn't get approved, they would lose the money that they've invested in the production. But the federal government has fronted the cost so that manufacturers can start producing vaccine even before they've received approval. And the benefit of that is that immediately upon receiving approval, then there's vaccine ready to be used. If a manufacturer would not meet the criteria and seek FDA approval, that vaccine would be destroyed, but they would not be out financially. So that's another thing that has been done to help speed up that process or make sure that vaccine is available in a much more expedited manner. But I will tell you that the expectation for a safe, pure, and potent vaccine has not changed, and manufacturers are expected to follow all of the good manufacturing regulations that are currently in place. So that has not changed, as well as the number of individuals that have been included in the clinical trials is consistent with what we've seen in clinical trials for new vaccines over the course of the last 15 years. So There are things that have been done to help make this process more efficient, but the core things related to vaccine safety have not been compromised. And in Minnesota, we have said that we will not use a vaccine until it has both FDA approval and the Advisory Committee on Immunization Practices approval. So we are committed to ensuring that the vaccines that we have for Minnesotans are as safe as they can be. And then to your question about, are we concerned about uptake? Well, I think it's important to keep in mind that when vaccine becomes available initially, it will be in limited supply. And so ultimately, yes, we want to make sure that all Minnesotans have access to vaccination, and we're hoping that just about everyone will take advantage of that, because obviously the more people who are vaccinated, the greater protection that we have across the state. But initially, there will be limited vaccine supply, and so until we have widespread vaccine, I think we're not worried so much about having people not be interested as the reverse, which is we'll have more people who want to be vaccinated than we will have vaccine available, at least in the first weeks.
Thank you, Kris.
Operator, we have time for one more question.
Okay, so for the last one, we do have Jill Barcombe from Star Tribune. You are now live.
Hi, can you hear me okay?
Hi, can you hear me okay?
Yes, we can. Cool.
Okay. All right. So last week, Minnesota Nurses Association President Mary Turner was on a conference call with President-elect Biden and said there is inadequate testing for hospital workers. Is the capacity needed for community testing taking away from what is needed to ensure that these frontline workers are tested, or is the community testing strategy kind of filling in to help address this problem?
Well, this is Commissioner Malcolm. I'll start, but certainly invite Dan or Kris to chime in as well. I think we absolutely think that the community testing sites are augmenting and need to augment the capability of the healthcare systems to test their workforce and their patient population. And we work every day to try to coordinate activities across that entire testing system to make sure that we have a line of sight into what the capacity is, what the turnaround times are, and are still working to try to assist the health systems in beefing up their capacity where needed as well. I think I recall Mary, and we've had conversations with Mary and others as well. I think there's a particular interest in getting more rapid testing available for healthcare workers. And that's a sort of a problem of a different nature, just in terms of needing for rapid tests to become more accurate, more specific to picking up COVID, and more sensitive to being able to discern true positives from false positives and the like. And Kris can say a lot more about that. But I think I believe that Mary's comment had to do also with just the speed of turnaround, not so much the lack of capacity, but just the speed with which tests can be done and resulted. But Dan or Kris, anything to add?
Yeah, thanks, Commissioner. I think it's important to remember that all of the community testing we're doing is adding to state capacity. We're not competing for finite capacity. We're actually increasing. So our contract and work with Vault Health and the IBX lab is we've built a brand new lab here in Minnesota. It's employing Minnesotans, and that is where all of the saliva tests are going. So that's all new capacity. So, and that's one of the reasons that we're asking for Minnesotans during this time, if you have symptoms, get tested. If you're a contact, get tested. But if you're able to lay low during this dial-back period, let's leave the community sites and other testing for people such as healthcare workers, because we as a state have added this capacity and we want them to be first in line. And that includes our first responders, our police and firefighters, our child care workers, and then people still working, say, in retail, grocery stores, et cetera. But the testing that we're doing at community sites is because we have increased our lab capacity. We can actually just do so many more tests now in Minnesota due to this effort. So it is not a zero-sum game. Thank you.
Thank you.
All right, thank you. That is all the time we have for this afternoon. If there are other reporters who have questions, please reach out to our communications office this afternoon. Have a good day, and we will be back with you again soon.
Ladies and gentlemen, this concludes today's conference call. You may now disconnect.